Hello Gold participants from around the world. Welcome to Gold Lactation Online Conferences for 2014. I'm Fleur Bickford, RN IBCLC and Program Chair for Gold Conferences. We're talking today with Nancy Wight, who is going to be presenting about NICU Nutrition, current status, opportunities and challenges. We're very happy to have Nancy presenting at the conference for us this year, and let's get to know her a little bit better. Nancy, how did you first become involved in breastfeeding, and what led you to become an international board certified lactation consultant?
Well, I think it was just watching the outcomes of my patients. When I was a resident, I had the privilege of being at UCSD, University of California in San Diego, and there was this strange pediatrician. Her name was Audrey Naylor, and she had this breastfeeding clinic. And of course, as a neonatologist, I wasn't quite sure what all that entailed, and of course we'd never been taught anything about human milk other than from the formula companies. But I started listening to some of the things she was saying about human milk, and then when I actually finished and started my own intensive care unit, I had these very strange mothers also. They were called the Leche League moms, and I had been warned in residency not to deal with these moms because they were very strange, you know, and they had very strange ideas. But I found they were the most cogent, intelligent, and forward-thinking women that I had ever met. And I started learning from the Leche League meetings. And then I discovered something called ILCA, the International Lactation Consultants Association, went to my first meeting, and after reading Ruth Lawrence's book, I was hooked, because my babies who were getting their own mother's milk were doing much better than those babies who were getting my special preterm formulas.
That's fascinating. Thank you, Nancy. It's always so wonderful when we can learn from the mothers that we're helping. And how do you feel that your talk will help other healthcare professionals who are working in the NICU and helping moms who are dealing with the challenge of having a baby in the NICU?
Well, I've been a neonatologist for over 30 years, and I've seen a gradual increase in the use of human milk in the NICUs. I've been working very hard as a physician. I was one of the first physicians to actually be board certified as an IBCLC, and I've been trying to talk with my other neonatologists, pediatricians, obstetricians, and it's finally, I think, reached the tipping point. So I know that nurses and lactation consultants are usually far ahead of physicians in changing practice. It takes a long time to change practice, especially when you've been given misinformation as a student or a resident. But, you know, over the last 30 years, we've gradually come around so that now we have physicians, we have the Academy of Breastfeeding Medicine, we have other healthcare professionals that actually listen to me and don't think I'm some kind of a breastfeeding zealot. We also have the American Academy of Pediatrics, who, for all its faults, does have a breastfeeding section and has produced some very good recommendations and policy statements. So I think we're at the tipping point, and I think my talk will help other healthcare professionals take the evidence and bring it to their physicians so that they can also be part of the wave of better nutrition for our NICU babies.
Wonderful. It's certainly a great thing that we're starting to see some change in all of this. Now, what kind of outcomes have you seen from a personal point of view? What is it that you're seeing with the babies that kind of keeps you doing this?
Well, the obvious, of course, is better nutrition that we can actually see, and long-term we're seeing less necrotized, less growth-restricted babies. Now, in the short term in the NICU, it's very obvious when you use breast milk that you have decreasing necrotizing or colitis. That was found out very early, 20 years ago. But in terms of long-term health, growth and development in immune systems, we're now seeing research, and I'm seeing personally babies who are healthier. They're not these short, fat babies that we used to see. They're long, lean babies with good head circumferences and good brain growth, and that's what we want to see. So I think personally I've seen a huge shift in the applicability of nutrition to the NICU. You know, NICUs are funny places. They tend to attract very active people who like to fiddle with IV drips and work on ventilators and all sorts of other equipment. Nutrition was not really a sexy topic for a long time, but now it is. Now people understand how important early nutrition is for long-term health, and I'm hoping that my contribution will improve the health of many NICU patients over the years.
Wonderful. Thank you so much, Nancy. We are certainly privileged to have you available to share your knowledge and expertise with us. For everyone who is listening, please take advantage of Nancy's expertise by taking part in the preterm package of our 2014 conference, and we look forward to seeing you online.